any of the southern states, the health facilities are simply abysmally bad. And even for a primary health center, the villagers have to walk for 40 kilometers. There are no motor roads. Now, if a lady is pregnant, sometimes you have to carry her on that, palanquin kind of thing, and carry her to the nearest center. And that's why this child mortality, MMR, all kinds of factors are very high there. And in fact, when a lady gets pregnant, in Jharkhand, they starve the pregnant lady. The reason they starve the pregnant lady is that the child will not become big. The child grows big, then delivery will be difficult. So she will not get milk, meat, or any of these high protein items, and the child born will be malnourished. Generation after generation is becoming malnourished. The whole state is in such a big problem. Now that's the other side of it. So that's where I organized certain programs for rural health, and I introduced certain programs called Barefoot Manager. Then I was going to introduce a Barefoot Doctor program so that people could go there and reach out. That's another side of the story. But having said that, India has a huge potential. The simple reason is any doctor in India gets to see 10 to 20 times more number of cases, in a day or in a month compared to a doctor in US or UK. So because of that, our doctors become a lot more experienced, be it a heart transplant or liver transplant. You talk about any complex kind of operations, our doctors are the best in the world. Despite low salaries, low issues, and so on and so forth. So this is where, for example, we need, for example, the health management to manage this entire sector itself. Of course, we got leaders like Dr. Edwin Joe, who are born leaders, but then we still need to train up people. The reason is, you can see the difference between a kind of a health sector and any other business sector. If you go to a McDonald's, you order for a
profession. That if health is lost, nothing is lost, and if health is lost, something is lost, and if character is lost, everything is lost. Because the character is lost in this world, there is disproportionate quantity of wealth with certain people, and health problems also in another area. Now it is our duty to patch up and bring an equilibrium which will naturally bring character back to life in the humanity. You think of any living being. God has created all living beings. No living being has a healthcare facility. You find lot of animals in the forest, lot of other living beings. No living being has a healthcare facility or a doctor, except the human being. And this profession of medicine started from the local area, that is local medicine or native medicine, which was practiced long back. And then after doing some research, it now became known as modern medicine, which we commonly call as allopathy. And there are also other systems of medicine in which research-oriented outcomes are not come. There are recognized systems of medicine. Now previously, the healthcare system was doctor-oriented. One doctor used to have a nursing home. He used to employ certain people for himself, employ a cashier to collect the money, and then as he thinks he will develop the hospital. That was the system some years back. After that, the hospital industry grew, and this doctor could not manage the management as well as his profession. So the healthcare professionals were introduced into the system to find out the flaws and make the necessary rectifications in the area, and ultimately now healthcare has become an industry. because the character has been lost in the medical profession. And as the coordinator Dr. Xavier told, have you seen a doctor smile? That was the question put before you. And as he said, doctors who don't have time to smile or seeing a large crowd, he could not smile. He or she could not smile. Maybe that's the fact by now. But in the long years by now, the doctor's timing in interacting with the patients have become so less, and the patient also is very choosy about the doctor, and the patient relies mostly on investigative findings to arrive at a diagnosis, and before going to a doctor, he googles out and finds out what are the things the doctor has to do. So naturally now, a patient goes to the doctor to examine the caliber of the doctor. And ultimately, if the caliber is not proved, he goes to another doctor. So finally, it is not the doctor who is the loser, the patient who is the loser, because the disease cannot be diagnosed by mathematical perfection, by books or computer. That is why still the profession of doctor is surviving.
Of classroom teaching in return. So it was a very welcome understanding. No cash transaction, no MOU, nothing. I mean, there was an MOU, but there was no issues. So we developed a very friendly relationship, a cordial relationship with the two institutes, which we felt that had similar, sort of thinking. That is not to make money out of the profession, but to ensure that people are healed and people are taught. I mean, that's what LIBA and CMC stand for. CMC, for example, stands for not making money out of patients, but trying to say, let's eradicate disease so that there are no patients. So it's a total paradigm shift. And so we have a fee structure, which sir will know, which is ostentatiously less in the country, least in the country. And I must say that Dr. Edwin Joe, he is the Director of Medical Education. And as you know, whatever we do, training is what makes us, or what makes the society. And Tamil Nadu is high-end on medical education. Thanks to you, sir, and your name comes up so many circles. In fact, I was going through the medical education for my daughter, and I was so amazed to see the way it's organized. The whole process is so meticulously organized. There are no doubts. You don't have to ring up anybody and ask any questions. So thank you, sir. I think it's your leadership. You might not be well trained or the MB and all, but it comes naturally. Just put my hand. You must be aware Tamil Nadu is way ahead among other cities in the area of health. I think there are about most number of medical colleges in this state. 24 medical colleges and 15 private colleges. I think it's the most among all the states in the country. Am I right? Yes. So I think that itself shows for leadership. And for sir to come for this program, I was really amazed for this. For the students, you must be very lucky. We got a very good medical education institute, management institute, and a premier hospital coming together to give you this.